come to me, an occupational therapist, a women's health therapist here at the chiropractic office, I really feel very strongly that women and moms in particular are underserved in this area of therapy and rehab, and there's so much that we can do. And I think women feel like some of our issues or our pains or our little quirks of being a mom or going through birth, such as leaking when they're jumping or running, or having their abs feel like they're mushy gushy even though you're 6 months postpartum, a year postpartum. People think that that's normal, or they think that that's just like gonna be there for the rest of your life. But the truth is that it's common, but it's not normal, and it doesn't have to be that way. And so if you're a woman and you have ab separation down your abs that isn't getting better naturally, that's something that I could see you for. If you have pelvic pain either during pregnancy or postpartum, that's something I want to see you for. If you have incontinence and leaking when you're jumping or running or sneezing or coughing, that's something. SI pain, hip pain, back pain, just the achiness that happens with being a mom and with being postpartum. Even women that have never had babies before and they have things around their period time, there's things that happen in a woman's life that, like I said, are very common, but it's not normal. And it's things that even if we get an assessment done and we can just see if there's anything we could do about it, that's a really positive step for a woman, because she's taking control over her body and because she is saying, you know what, I really value myself and I really deserve to have a really strong amount of care for myself. This is like the ultimate self-care for a woman, and know how powerful this work can be from my own personal experience and just from seeing the benefit that it has across the spectrum. Either way, if you see a chiropractor for it and they can refer you to me, or you could see your OB and they could refer you to me, that it's a wonderful complementary partnership between all of these disciplines that unfortunately people just don't know enough about with as far as women's health go. And you might just have to ask, can I just get a referral for some therapy? And I'm sure the OBs are not going to have any fight or any battle with it. You're pregnant and you're like, I want to learn how to have this baby, how to go through the birth process without damaging my pelvic floor. So I can help with birth positionings, I can help with breathing techniques, I can help with posture, and there's just so much that goes into it that this population really would benefit from some therapy. I want to be able to provide that to the women of the Fox Valley area and women who want to move their body, women who enjoy moving their body, not even in an exercise perspective, but just in a life perspective, in playing with their kids and being able to ride bikes down the road and back and swinging and all of these things that we kind of take for granted until we have something that makes it so we can't do it.